In the history of traditional Chinese medicine, or TMC, there are 6 main people who had huge contributions in the growth and development of Chinese medicine. The first was Zhang Zhongjing, a Han Dynasty physician. He established medication principles and summed up the medicinal experience up until that time. Next was Han Tuo, a late Eastern Han Dynasty physician. He was the first person in China to use anesthesia during surgery by combining wine with an herbal concoction called ma fiasan, literally cannabis boiled powder. Another was Sun Sumiao. During the Sui and Tang Dynasty, he wrote 2 books summarizing pre-Tang Dynasty medicine. Tao Hongjing lived years 451 to 536, and his research consisted of proper eating and living practices. Through that, he produced one of the major pharmacological works of China, the Tu Jing Tanti Ben Cao. Zhang Jiegu was alive during the Northern Jin Dynasty to the Mongolian Yuan Dynasty. Zhang Jiegu integrated medicinal materials into 5-element framework, Wuxing, both of the 5 Shun herbs framework and Qi meridians. The last was Li Shijun, who lived from 1518 to 1593. He wrote the Ben Cao Gangmu, which is a book that has details about more than 1,800 drugs in Chinese medicine, including 1,100 illustrations and 11,000 prescriptions. It also described the type, form, flavor, nature, and application in disease treatments of 1,094 herbs. The concept of yin and yang is used to describe how opposite or contrary forces are interconnected and interdependent in the natural world, and how they give rise to each other as they interrelate to one another. In traditional Chinese medicine, good health is directly related to the balance between yin and yang qualities within oneself. If yin and yang become unbalanced, one of the qualities is considered deficient. The 5 phases or 5 elements theory. This theory presumes that all phenomena of the universe and nature can be broken down into 5 elemental qualities, represented by wood, fire, earth, metal, and water. Strict rules are identified to apply to the relationships between the 5 phases in terms of sequence, of acting on each other, of counteraction, etc. All these aspects of 5 phases theory constitute the basis of the Zhangfu concept, and thus have great influence regarding the TCM model of the body. 5-phase theory is also applied in diagnosis and therapy. There are 4 main methods of traditional Chinese medicine: acupuncture, herbal medicine, massage, and exercise.
Dating back over 2,000 years, acupuncture is a system of healing that focuses on improving the overall well-being of the patient. Health problems are treated by the insertion of fine needles into the body at specific points, based on ancient Chinese theories of the flow of qi through distinct pathways or veins throughout the body. Qi literally translates into air and is essentially what we know today as oxygen. The insertion of acupuncture needles stimulates and enhances the flow of qi, which in turn relieves pain and helps to restore health. The location of the point selected, the nature of the problem, the patient's size and age, and acupuncturist style are all factors that will determine how deep the needles actually go. Acupuncture needles are usually inserted from 1/8 to an inch in depth. The number of treatments required for healing varies depending on the duration, severity, and nature of the ailment.
Chinese herbal medicine accounts for the majority of treatments in Chinese traditional medicine. The word herbal is misleading. Although mostly plants are used for this treatment, animal, human, and mineral products are utilized. Therefore, the preferred term is medicinal or yao in Chinese. The first recognized herbalist is Shenong. He allegedly tasted hundreds of herbs and imparted his knowledge of medicinal and poisonous plants to farmers. He wrote a book which classifies over 365 species of plants, woods, animals, and stones into 3 categories. The first category is the superior category, which includes herbs used to cure multiple diseases and help maintain body balance. In addition, these herbs have almost no unfavorable side effects. The second category consists of tonics and boosters. The third category includes substances that must be taken in small doses and used for specific diseases.
The practice of Chinese herbal medicine varies between doctors, but the general practice remains the same in that the herbal medicine prescription is comprised of many substances tailored to the individual patient. A prescription can consist of about 9 to 18 substances. Some substances are the main herbs, while others are meant to act as a catalyst or to cancel out the toxicity or side effects of the main ingredients. Another part of Chinese herbal medicine is Chinese patent medicine. This practice is a standardized herbal formula meant for patients whose conditions are not severe. In ancient times, medicinal substances were dried, crushed, and molded into a pill. These pills are known as tea pills. Nowadays, an herbal dough made from herbal powders is created with the use of water or water alcohol and molded into little round black pills using a machine. The last part of Chinese herbal medicine is Chinese herbal extracts. Herbal extracts are simply the raw form of the herb condensed into a granular or powdered form. These extracts are similar to patent medicine in that they are easier and more convenient for patients to take.
There are over 300 herbs being used today. The more commonly known herbs are ginseng, wolfberry, cinnamon, ginger, licorice, and rhubarb. Ginseng comes in either red or white, with red believed to be the more effective of the two. It is used to treat dry coughs, constipation, and fevers. Cinnamon is a spice used to warm and unblock channels within the body. Ginger is an herb and a spice used commonly in Chinese cuisine. Ginger is used to warm the inner body. The licorice plant is thought to help treat hepatitis, sore throats, and muscle spasms. Lastly, rhubarb helps to drain damp heat and invigorate blood. These are a few of the many herbs used today in traditional Chinese herbal medicine.
The Chinese also practice various forms of therapeutic exercise to help maintain and restore health. Qigong and Tai Chi are two of the most popular forms and use slow, gentle movements to activate the flow of oxygen within the body to enhance balance, coordination, strength, and flexibility without strain. Great attention is paid to correct body alignment, which improves posture and can benefit many musculoskeletal problems. Qigong is mostly used as a hospital-based therapy in China and is a collective term covering over 4,000 different traditions of health exercise, meditation, and martial arts power training, which have evolved throughout China over the last 5,000 years. It combines aerobic conditioning, isometrics, isotonics, meditation, and relaxation. It is said that Qigong can help one fight virtually any disease, and that through consistent practice of Qigong, patients can cure up to 50% of all diseases that Western doctors dismiss as untreatable or psychosomatic. Tai Chi is a martial art based on Qigong principles. The elementary stages of this martial art have become popular throughout the world as a gentle exercise for older people. It involves slow motion, moving, meditative exercise for relaxation, health, and self-defense. The movements are based mostly on circular motion and flow at a smooth, even tempo, making for perfect balance as the weight of the body is shifted from one side to the other. By perfecting the movements, one learns both coordination and relaxation of the entire body. The resulting control leads to a very high degree of physical proficiency.
This form of traditional Chinese medicine is used in conjunction with acupuncture and other treatments. It is known as a manipulative therapy. Massage is known as tuina. It is a hands-on treatment that uses Chinese Taoist and martial arts principles in an effort to bring the body into balance. The practitioner may knead, brush, roll, and rub the areas between each of the joints in an attempt to release the body's defensive qi and allow the energy to move into the muscles. Tuina is taught as an integral part of the Oriental Chinese medical course. In ancient China, tuina was considered an external treatment suitable to be used on the elderly population and on infants. It is also divided into subcategories such as specialized treatment for adults, infants, rehabilitation, and sports medicine.